If you woke up this morning and felt like your head was packed with wet cement, pressure behind your eyes, a dull throb across your forehead, that maddening sensation of your nose being completely blocked, even when you blow it and nothing comes out, then do not touch that remote. Do not swipe to the next video, because what I'm about to show you in the next few minutes could give you relief faster than any pill, any spray, or any steam shower ever has. I'm Dr. Watsun, and today I'm going to show you one simple science-backed move that helps your sinuses drain rapidly, naturally, and without a single side effect. Stay with me until the very end, because I'm also going to share a powerful combination technique that most doctors never teach their patients, and once you know it, you will never go back. Before we get into the move itself, I want you to truly understand what is happening inside your head right now, because knowledge is what makes the difference between someone who just follows instructions and someone who actually gets lasting results. Your sinuses are a network of hollow, air-filled cavities located in your skull, behind your forehead, behind your cheekbones, between your eyes, and deep behind your nose. Under normal, healthy conditions, these cavities are lined with a thin layer of mucus that traps dust, bacteria, and irritants, and tiny hair-like structures called cilia sweep that mucus continuously toward the back of your throat where you swallow it without even noticing. The entire system is elegant, efficient, and largely invisible when it's working properly. But when something goes wrong, whether it's a viral infection like the common cold, seasonal allergies, environmental irritants, dry air, or even barometric pressure changes from weather, the lining of your sinuses becomes inflamed. That inflammation causes two catastrophic things to happen simultaneously. First, the tissue swells, narrowing or completely closing off the tiny drainage openings called ostia that connect your sinuses to your nasal passages. Second, the mucus production goes into overdrive, generating far more fluid than the now compromised drainage system can handle. The result is what you feel: pressure, pain, fullness, congestion, and that foggy, miserable heaviness that makes it hard to concentrate, sleep, or simply function like a normal human being. And here is the part that most people find surprising: blowing your nose harder, using more decongestant spray, or just suffering through it are not effective long-term strategies. In fact, aggressive nose blowing can actually force bacteria-laden mucus backward into the sinus cavities, making things worse. What you actually need to do is open those drainage pathways and use gravity and gentle lymphatic stimulation to move the fluid out. That is exactly what today's technique does. Now let me introduce you to the approach. What we are working with today draws from two powerful, well-researched methods: a lymphatic drainage massage that has been used in medical therapy for decades, and a simple pressure and positioning technique rooted in basic anatomy. Together, they create what I call a rapid sinus drainage sequence. You can do this sitting in a chair, lying on your bed, or even at your desk at work. You need no equipment, no oils, no special tools, just your hands and about 5 minutes of focused attention. Ready? Let's walk through it step by step, and then I'll put it all together into a fluid routine at the end. We begin with what I call the gateway clearance. Before you can drain your sinuses, you need to open the lymphatic pathways in your neck that receive the draining fluid. Think of it like this: before you unclog a drain, you need to make sure the pipe leading away from it is open. The lymph nodes in your neck, particularly those running along the sides and the ones sitting just above your collarbone, are the downstream stations for sinus fluid. If they are congested or tight, you are draining into a closed system and nothing will move efficiently. To activate these pathways, place the flat pads of your index and middle fingers on either side of your neck, just below your ears. You are not pressing hard. This is a light, gentle pressure. Now make slow downward strokes along the sides of your neck, moving from just behind the ear down toward your collarbone. Do this 10 times on each side. Then move your fingers to rest just above your collarbone in that soft hollow area and make gentle inward circular motions. 10 circles on each side. You may feel a slight warmth or tingling as circulation increases. Some people even feel a very subtle urge to swallow, which is a good sign that the lymphatic system is waking up. This opening step takes about 60 seconds, and it makes every single step that follows dramatically more effective. Do not skip it. The second phase is the nasal bone press and release, and this one often produces an almost immediate feeling of movement inside the sinuses. Take both index fingers and place them on either side of the bridge of your nose, not on the soft part, but on the firm bony part just below the inner corners of your eyes. Apply a firm, steady inward and upward pressure, as if you are trying to press the two sides gently toward each other. Hold this pressure for 5 full seconds, then release slowly. Repeat this 3 times. What you are doing here is stimulating the ethmoid sinuses, which sit between your eyes and are some of the most frequently congested sinus cavities in the human skull. The pressure and release cycle creates a gentle pump effect that encourages fluid to shift toward the drainage openings. Many people feel a sensation of subtle movement or loosening almost immediately. Others notice that their ears feel slightly different, a small pop or a sense of equalization, which tells you that the pressure in the sinus system is beginning to shift. Next, we move to the cheekbone press, targeting your maxillary sinuses, the largest of the 4 sinus groups, located behind your cheekbones on either side of your nose. These sinuses are notorious for collecting fluid because their natural drainage opening is actually located near the top of the cavity, which means gravity works against drainage unless the opening is clear. Place the flat pads of your 3 middle fingers on each cheekbone, positioning them so they rest along the ridge of bone just beneath your eyes. Apply steady downward and inward pressure. Hold for 5 seconds, then release. Repeat 5 times. After the press and release cycles, change the motion to small, firm, circular strokes, not sliding across the skin, but pressing in small circles so the skin moves with your fingers. Work from the outer edge of your cheekbones slowly inward toward the sides of your nose, 10 circles in each direction. You may notice your nose beginning to run slightly during this step. If it does, this is a wonderful sign. It means the drainage is beginning and the mucus is starting to move toward the exit. Let it happen naturally. Now we come to what I consider the most underrated step in the entire sequence, and that is the forehead press targeting your frontal sinuses. Your frontal sinuses live behind your forehead, above your eyebrows, and when they are congested, they produce that heavy, pressing headache that sits right across the brow line and makes bright light unbearable. To address them, place your thumbs above each eyebrow, as close to the brow bone as is comfortable, and use firm upward pressure, pushing slightly toward the forehead. Hold 5 seconds, release, and repeat. Then use your index and middle fingers together to make firm, slow upward strokes, starting at the center of your forehead and moving outward toward your temples. Think of it as smoothing something out from the midline outward. You are encouraging fluid to move toward the side drainage channels. Do 10 strokes in each direction. Follow this by pressing your fingers in at the temples themselves and making slow, firm, circular motions. The temporal region is a key junction in the head's lymphatic system, and stimulating it helps move fluid out of the cranial area efficiently. Now I want to teach you the position technique that amplifies everything you just did, and this is the part that most people do not know about. After completing the massage sequence, or even by itself if you are somewhere you cannot do the massage, there is a body positioning method that uses gravity to mechanically assist sinus drainage. Lie on your back on a flat surface. Now tilt your head to one side so that your ear is pointing toward the floor, and stay in this position for 30 to 45 seconds. What this does is position the maxillary sinus on the upper side of your head so that its drainage opening, while inconveniently placed under normal circumstances, now has gravity on its side. Fluid that has been loosened by the massage can now begin to flow downward through the ostia and into the nasal passages. You will often feel a dripping or shifting sensation or increased nasal flow on the side facing down. After 45 seconds, slowly roll to the other side and repeat. Then, sit up slowly and allow 30 seconds before blowing your nose very gently, one nostril at a time, with your mouth slightly open to equalize pressure. Now let me put this all together into the complete rapid sinus drainage routine, which when done as one continuous flow takes approximately 5 minutes and can be repeated up to 3 times per day during periods of acute congestion. You begin with 60 seconds of gateway clearance, those downward neck strokes and collarbone circles. Move immediately into 3 rounds of the nasal bone press and release. Follow with 5 rounds of the cheekbone press and 10 circular strokes on each side. Then do the forehead strokes and temple circles. Finally, lie down and do the gravity positioning technique, 30 to 45 seconds per side. Sit up, wait 30 seconds, and gently clear your nose one nostril at a time. That is the complete sequence. It sounds like a lot when described in detail, but once you have practiced it twice, it flows naturally and becomes almost meditative in its rhythm. Now I want to speak to you directly about something important. If you are someone who has been suffering from chronic sinusitis, recurring sinus infections, constant post-nasal drip, or sinus congestion that never fully clears, this technique is incredibly helpful as part of your management routine. But it is not a replacement for proper medical evaluation. Chronic sinusitis can sometimes involve structural issues like a deviated septum, nasal polyps, or persistent bacterial infection that requires medical intervention. What this technique does is support your body's natural drainage, reduce the frequency and severity of congestion episodes, and give you a powerful tool for immediate relief during flare-ups. Think of it as the daily maintenance your sinuses deserve, not as a reason to delay necessary care. If you have had sinus symptoms lasting more than 12 weeks, if you have fever alongside facial pain, or if you notice any changes in vision or neurological symptoms alongside your sinus pressure, please see a qualified healthcare provider promptly. Let me also talk about some supporting habits that dramatically increase the effectiveness of this technique and help prevent the buildup of sinus congestion in the first place. Hydration is the single most underrated factor in sinus health. When your body is even mildly dehydrated, the mucus in your sinuses becomes thick and sticky rather than thin and flowing. Thin mucus drains on its own. Thick mucus does not. Aim for adequate daily water intake. The commonly cited guideline is around 8 glasses for the average adult, but individual needs vary. Adding warm liquids like herbal teas, warm broth, or even just warm water with lemon throughout the day has a direct warming and thinning effect on sinus mucus that complements the drainage massage perfectly. Humidity in your environment matters enormously as well. Dry air, which is common in air-conditioned offices, heated rooms in winter, and airplane cabins, dries out the sinus lining, slows cilia movement, and causes mucus to thicken and stagnate. A cool mist humidifier in your bedroom, running at night, can make a profound difference in how you feel by morning. If you do not have a humidifier, even a bowl of warm water placed near your bed with a few drops of eucalyptus oil creates a modest humidity boost. Speaking of eucalyptus, steam inhalation is a powerful companion to the manual drainage technique. Fill a bowl with very hot water, add 2 to 3 drops of eucalyptus or peppermint essential oil, drape a towel over your head to trap the steam, and breathe deeply for 5 to 10 minutes. The combination of warm moisture and the natural decongestant compounds in these oils helps loosen and thin mucus before you do the drainage massage, essentially preparing the system for better results. If you want maximum impact, do your steam inhalation first, then immediately follow with the complete drainage sequence described today. Nasal saline rinses are another evidence-based tool that works brilliantly alongside everything we have discussed. A simple saline rinse, whether using a neti pot, a squeeze bottle, or a saline spray, physically flushes mucus and debris from the nasal passages and keeps the sinus drainage channels clear. Research consistently shows that regular saline irrigation reduces the frequency of sinus infections, reduces reliance on medications, and improves quality of life in people with chronic nasal and sinus conditions. If you are new to nasal rinsing, start with a gentle saline spray available at any pharmacy and use it once or twice daily. For those who are comfortable with it, a full neti pot rinse using properly prepared sterile or distilled water is even more thorough. Always use sterile or distilled water, never tap water directly, and ensure your equipment is kept scrupulously clean. Now let's address the question I know many of you are thinking: how quickly will I see results? The honest answer is that it varies, and I always believe in being truthful with you rather than making promises that set you up for disappointment. Many people, perhaps the majority, experience noticeable relief during or immediately after their first session. The sensation of pressure reducing, the nose beginning to run, or just a general feeling of loosening is often felt within the first 5 minutes. For others, particularly those with very thick, long-standing congestion, it may take 2 to 3 sessions before significant relief is noticed. For people incorporating this into a daily routine, alongside the lifestyle habits I described, most report meaningful improvement in their chronic congestion within 1 to 2 weeks. What is consistent across almost everyone who uses this technique faithfully is that it works, gently, naturally, without side effects, and with compounding benefits over time. One final point I want to make before we close out today's video: your sinus health is connected to your overall health in ways that are easy to underestimate. Chronic sinus congestion disrupts sleep because it forces you to breathe through your mouth, which reduces the quality and oxygenation of your sleep, increases snoring and sleep apnea risk, and leaves you waking up exhausted. It contributes to chronic headaches that people often attribute to stress or screen time. It can affect your sense of taste and smell, which in turn affects your enjoyment of food and your nutritional choices. And persistently blocked sinuses create a warm, moist environment where bacteria thrive, increasing your risk of recurring infections. Taking your sinus health seriously is not a minor thing. It is connected to your energy, your focus, your sleep, your immunity, and your overall well-being. The 5 minutes you invest in this routine is an investment in all of that. I am Dr. Watsun, and my mission with every single video I make is to give you real, science-backed, practical tools that you can use right now to improve your health, without confusion, without overwhelming medical jargon, and without leaving you feeling like you need a medical degree to take care of your own body. That is what this channel is about. If this video helped you today, if you felt even the smallest amount of relief or gained even one piece of knowledge you did not have before, then I am asking you, from the heart, to click that subscribe button right now. Not because numbers matter to me, but because subscribing means the next time I post something that could genuinely change how you feel, YouTube will make sure you see it. You will not have to search for it. You will not miss it because an algorithm buried it. It will come straight to you. And I post regularly, so there is always something new to help you live better, breathe easier, and feel like yourself again. Hit subscribe, ring the notification bell so you never miss a video, and drop a comment below telling me how this technique worked for you. I personally read every single comment and I want to know about your experience. Until next time, take care of yourself, breathe well, and I will see you in the next video. Script by Dr. Watsun. Approximate runtime, 18 to 22 minutes at natural speaking pace.